Let's kick things off with this really powerful idea from Dr. Uriel Ramirez, the founder of the Pan American Medical Association. He says, "We don't just provide care, we mobilize teams." This isn't just a nice sentiment, it's a blueprint. It's about building something bigger, something more just, one piece at a time.
So that brings us to the Pan American Medical Association, or PAMA for short. They're pioneering a whole new way of thinking about health equity. And in this explainer, we're going to break down exactly what makes their approach such a game changer.
So what's the big problem PAMA's trying to solve? Well, it's this huge critical gap in healthcare access. The reality is, across the Americas and the Caribbean, your zip code can literally determine your quality of life. And PAMA was created to change that for good.
To do that, their entire mission is built on one core idea: solidarity. And look, this is more than just a word choice. It's a fundamental shift away from that old top-down charity model towards something much more powerful: real, genuine partnership. And at the very heart of it all is this one powerful belief. For PAMA, health is a human right, period. It's not a gift you give to people who are less fortunate. This single idea shapes every single decision they make. And you can really feel what that partnership is like on the ground from this quote. It's just incredible. This isn't just someone saying thanks for the medicine, it's a thank you for dignity. When Antonio de la Paz Cruz says his community felt seen and heard, he's talking about the profound difference between charity and true solidarity. Okay, so how do they actually do this? How is PAMA really different in practice? Well, it all boils down to their system, which stands on three key pillars: ethical logistics, crystal clear measurement, and deep community trust. This slide just breaks it down perfectly. You've got the traditional way, which often feels like just drop shipping supplies with very little accountability. Then you have PAMA's model, built on partnership and what they call narrative accountability. It means the stories and the data are just as important as the supplies themselves. It's about proving the impact. So who's on the ground making all this happen? Well, that would be PAMA's frontline force, a specialized group known as the Solidarity Medical Impact Team, or SMIT. These are the folks turning that philosophy into real-world action.
So what in the world is a SMIT? Okay, think of them as way more than just logistics experts. These are highly trained leaders. They don't just coordinate aid, they run equity audits to make sure it's all fair, and they work to build that deep, lasting trust. And here's the key: they don't just move boxes of supplies, they actually help move entire systems forward.
All right, a great philosophy is one thing, but does it actually work? Let's take a look at the impact. PAMA is all about transparency, so they use both hard data and human stories to show what's really going on.
Now, here's a key tool they use. It's called the Solidarity Shipment Index, or SSI. And get this, it's not some off-the-shelf metric. They built it themselves. It's a custom score from 0 to 10 that measures both how effective their shipments are and how ethical they are. It's accountability you can actually see. And you can see just how powerful this is right here. When they started, their SSI score was at 3.5. You know, that showed them exactly where the problems were. But look at this jump. By 2024, they shot up to an 8.7, and now they're at an incredible 9.5. This isn't just a number going up, it's proof of a relentless drive to get better. So what does a score like that actually mean in the real world? It means 2.5 tons of essential medical supplies made it to frontline clinics in 2024 alone. That is a massive, tangible impact, and it's all driven by that focus on doing things the right way. But, as impressive as those numbers are, they only tell part of the story. The real magic happens at the human level. So let's zoom in on one specific community, Aldea Pitzal in Guatemala. Just listen to what Dr. Alicio Palico said after PAMA delivered an ultrasound system. He says it wasn't just a machine, it was a lifeline. But then he gets to the core of it all. You didn't just send equipment, you helped build trust, dignity, and a stronger future. That right there is the difference. So, this all leads to the big question. How can we be a part of this? PAMA sees this as a movement, and they make it really clear that it's not just about donating, it's about participating.
And what's cool is that there are so many ways to plug in. Yeah, they need clinicians and donors for sure, but they also need logisticians, storytellers, people who can build coalitions and partnerships. There's a role for just about everyone in this movement.
So we'll leave you with the very question that PAMA is built on. Really think about this. What if we stopped seeing healthcare as charity we give away and started treating it as a shared responsibility that we all own together? What could we build then?